Hey everybody, I am Dr. Matt Panetti. Welcome to the South Denver Health Expert Podcast. I am joined here today by Dr. Lindsay Williams. She's of Vivos. She's going to explain a little bit about what they do and what they are all about. But today we're talking about sleep apnea. And so without further ado, I'm going to have you take it. First off, how did you get involved in the dental industry?
Yeah, so I was born in California, and I went to school at the University of Maryland for dental school. And, you know, through college days, I had tried to figure out my career, and I was thinking I love art and I love science, and I finally got a job at the dental school and was like, oh, I can combine art and science together in dentistry, because I thought I wanted to be a doctor, but then this seemed like the perfect fit for me. So that's why I ended up applying to dental school, and where the dental part came in, because I wasn't one of those that had my dad a dentist and that. I was a pioneer in my family of going into dentistry. So that's kind of where that came from. And then after graduating dental school, I moved back here to Colorado, and my parents live here. So I got a job as just a general dentist, and I did general dentistry for 8 years, 4 years with a corporation, 4 years in a private office. And I just got to a point where I was at a crossroads, and I was trying to think of what I wanted to do at that point, whether it was buy my own office or do something else. I was considering putting my kids in braces, and then I heard about Vivos. So I looked more into that, and then came about this job here, and I saw what the amazing things they were doing with kids and adults, and I thought, man, how do I get into this? So I got a job here in Highlands Ranch at the Vivo Center, treating patients here.
And speaking of Vivo Center, there's a lot of dentists around the country doing this kind of work, but this is the headquarters, correct?
Yeah, so I'll kind of explain a little bit of where Vivos went with that. So at first, Vivos wanted to, create these breathing wellness centers. But we realized after we had 5 of them in Colorado, and then we realized we weren't reaching enough patients, right? We're really in the interest of saving people's lives and really getting to the most mass number of people. So in the centers, these practices started without any patients, so we had to build them up and all of that. But then when they realized we could go to individual dentists and have them become Vivos providers as well in their office,
Sure.
That's kind of where we pivoted, which has been amazing. So we're getting a lot of dentists throughout the whole United States becoming Vivos providers so that they can actually deliver all these services to their patients as well. So that's kind of where our company is now headed, which is amazing. But we still have this amazing center where we're treating patients and all that, kind of to explain that.
Okay, and so now I guess the natural question is, what is Vivos? What exactly is this?
Right, so Vivos is a system, right? Okay. So we look at the whole body health. Here we, assess a patient from top of the head to the clavicle, their posture, all of that. We're looking at the spine to see, if something is off there. We're looking at the mouth. We're doing complete head and neck exams. We're doing cone beam evaluations so that we can look at airways. We're really doing the whole body health. We look at nutrition. We look at to see if they possibly need to see an ENT. We're evaluating the person to see what's really going on. And a lot of patients here go home with sleep tests where we can see truly what's happening in their sleep, and all of that, gets reviewed by a board-certified sleep medicine doctor to give them a diagnosis if they have one of sleep apnea.
Okay.
And that's kind of what we do.
So in terms of sleep apnea, most people, I guess I don't know about most people. I just think as me, if I was a lay person, I had no idea about sleep apnea. If I had a sleeping problem, I'd go see a sleep doctor. Tell me why it's so important to come see somebody like you when it comes to something like that.
So sleep apnea is one of the most undiagnosed things in the country, right? We think 50% of the population has an issue, and they're not even aware of it. Most patients that come here, they're like, "Oh, I'm tired during the day," but they don't know they actually have sleep apnea. So when we tell them that,
why is that?
They have symptoms of fatigue maybe, but they just don't experience the waking up and gasping, and it could just be a little symptom as snoring, right? Where everyone thinks, oh, snoring, oh, it's so funny or cute. Well, not really. Snoring is not cute or funny. That's usually indicative of a true sleeping and breathing disorder while they're sleeping. Okay. So in terms of AHI, which you hear is the apnea-hypopnea index, and that means how many times an hour you stop breathing. So when we get the report back, I can see, say you stop breathing 30 times an hour, that's a severe sleep apnea diagnosis given to by an MD. But so that's a 10-second hold your breath, which is a long time if you actually sit there and hold your breath for 10 seconds. That's what we're talking about with that score. And that's what everyone looks at as that score for how severe the issue is.
Okay, and in terms of severity, why is holding your breath so severe? Why is that a problem for people?
Right, so think of oxygen and how important oxygen is to all of your cells in your body, right? So these are people that are dipping down. When they hold their breath for 10 seconds at a time or even longer, they're getting below 90% oxygen, right? So when you have that pulse ox machine at the hospital, if it goes below 90, the alarms go off, right? So these patients are actually getting below 90 for hours at a time at night. And there's no alarms going off in their bedroom saying, wake up, you're not breathing.
Scary.
Yeah, so your whole, everything, 200 times more likely to have Alzheimer's and dementia when you have a diagnosis of sleep apnea. 10 years off your life expectancy when you have a diagnosis of sleep apnea. So these are the kinds of conversations we're having with patients that are really eye-opening to them, that they need to figure out a solution to this problem.
Okay, so let's say somebody doesn't think they snore.
Yeah.
They don't think they have sleep apnea, but they wake up in the middle of the night and they go to the bathroom.
Yeah, so that's another symptom that is one of those that, oh yeah, no, that's normal to wake up to go to the bathroom in the middle of the night.
Right.
Well, no, it's not. That's usually because they've got a fight or flight reaction in the middle of their sleep, and that's what wakes them up. And so it turns out that they don't actually really have to go to the bathroom, but you get that urgency and feeling, and that's what that trigger is.
Scary. So, because I have a lot of people come in and tell me the same thing. Well, I sleep through the night, I just wake up and go to the bathroom.
Yeah.
So, in terms of sleep apnea, what are the solutions out there? What do people typically go to?
Yeah, so gold standard for medical is a CPAP machine, right?
Which is what?
It's, the Darth Vader mask. That's one of the types. There's a nasal pillow, which just goes around the nose. There's an AutoPAP, BiPAP. There's all these different kind of variations of the CPAP. And it just forces air into your body at night, right? So that's not really a natural thing. And research has shown that over time, long term, they actually end up worse after sleep apnea treatment, just because, but that's all they've got, right? The medical community, that's all they know. They know that there's a CPAP.
So before we go too far, talk about that a little bit. Why would someone who's on a CPAP machine actually be making their problem worse?
Because all of the tissue becomes flaccid and weak, right? Because you're you lose the tension of all the muscles there. So you become a lazy breather. Mm-hmm. You become a real lazy breather after CPAP use. But we don't go against that here. We actually have a lot of patients that go, through appliance therapy and CPAP at the same time because their problems are that severe. But, so we're not anti, but we know that that's not the ideal solution out there.
I understand
that's what
that.
They've got.
I get that. And from my perspective, part of the reason why I like you guys so much is that approach. I feel like that goes for anything with the human body. If we're putting a crutch or some sort of brace around any kind of part of the body, it's going to become weaker over time if you're not using it.
Absolutely.
So that makes perfect sense. Okay, so the CPAP machine is one of the options. What are some other options out there?
There's oral appliance therapy, right? There's losing weight, there's oral appliances, and Vivos looks at all those things, right? So we have a series of appliances here that treat that. We have some appliances that are cleared for palatal expansion, some that are cleared for snoring and mild to moderate sleep apnea. So we have an array to kind of choose from, and every patient's its own unique puzzle, right? So we have to get to the bottom. Is it an upper airway? Is it lower? And we really look at all that when we try to diagnose someone to figure out a solution to their issue.
Okay, so with that being said, tell me a little bit specifically about Vivos. How does this work with you guys? Because it's not a CPAP machine, right?
Right.
And it's not something that's permanent with this person either, correct?
Right, no.
So talk a little bit about that.
So we'll go through an appliance therapy with the patient, right? And average treatment time here is about 18 to 24 months where they'll go into this appliance. And then we get palatal expansion on a lot of people. And in my experience as a doctor here in the center with my patients, there's some amazing side effects and outcomes in addition to just expanding their palate.
It's not just sleep apnea.
Yeah, they are seeing, I have some patients that couldn't breathe through their nose at all, like not even long enough for that x-ray machine to go around their head.
Wow.
And now he has full breathing through his nose when he drives in his car. He can breathe through his nose, keep his mouth shut. So the nasal effects that I've seen with my patients have been amazing. Not to mention feeling better, sleeping better, all from just expanding their palate. And we're just getting these amazing outcomes.
So one thing and speaking of the outcomes, one thing that I thought was really interesting was looking at the visuals of these people beforehand and looking at their chin and the definition around their face before they had any kind of device and then afterwards.
Yes.
Crazy difference.
So a lot of that, this is going to go real sciencey, but Dr. Singh, who's the inventor of this appliance, he researched temporospatial patterning. So this is waking up your spatial patterns to where you should have originally grown. So a lot of our theory and what we believe with our appliances is that we're waking things up to your own original genetic map of where you should have grown to originally. And so that's kind of a lot of what the science is behind our appliances.
So knowing what you could have been, but why do we not reach our maximum? Why do people have stunted growth in their cheeks and in their jaw?
Right. So through a lot of the research and anthropology that we've shown with studies of, a few different guys, and we educate all patients on this, right? So we have all patients go through this education seminar so they really see why did they get into the situation they're in. And so we talk about this research, and this research showed that, it's a lot of Western diet and Western culture and all of that, we didn't have, go figure, enough muscle, not hard foods, not breastfeeding for long enough, where we ended up into this situation because, bone follows muscle. So if we weren't working them out, they weren't developing to where, and so everyone's kind of stuck behind this, 2 to 4 age level where we should have come forward and down.
Feels like that. I mean, the overlap in terms of our Western lifestyle, it goes into pretty much every healthcare profession, but it all boils back to that, right?
Always.
Yeah. Okay.
You are what you eat.
Right. So say someone comes in and they've got significant sleep apnea.
Mm-hmm.
You guys realize, okay, yeah, this person would be a good fit for Vivos. Tell me the timeline. How does this all work?
Yeah. So how it works here is they come through the education seminar, they'll come through a full new patient screening, and we have free new patient screenings for patients.
Okay.
If we deem that they're a candidate for our oral appliance therapy system, we will send them home with a sleep test.
They do it at home?
At home, easy.
Not
it's just
in a hospital or a room.
Right,
okay, cool,
and
cool.
it's a minimal fee. It's just $75 for a sleep test at home. It's a probe on the finger, a wristwatch,
okay,
a little positioner sensor, and that's all it is. And they go home with that. They come back the next day. We kind of go over the results. We talk about a plan. We talk about a plan for the patient, go over their finances, and they decide if they want to do it. But truly, it's that sleep test that really makes an effect in their brain on whether they're doing this.
Yeah, that's awesome. That's awesome. I think this whole thing is super beneficial. I like the approach that we're not just covering up symptoms, like nothing against the CPAP. Like you said, sometimes we need that, at least to get us through the hump. But ultimately, it's not a correction, which is where we come from it too. So how do people get a hold of you? How do people get seen in here?
Yeah, so we are located in Highlands Ranch. We also have a center up in Johnstown, Colorado north, if anyone's north. They just have to call here, make an appointment with the center to come in for the free screening, and they'll set them up with an education meeting time.
Okay.
And do you want the phone number?
Yep, give us the information.
720-239-7366. 7366.
There you go. And is there a website?
Yes, it's www.vivoslife.com, and that kind of explains the science. If you really want to dive into the articles and the research, and there's some hidden pictures of what the appliance looks like and all of that. But we treat adults and kids. We have one of our main things is we've got a kid guys series of appliances that can straighten teeth and avoid braces. So that's one of the main perks to some of these appliances as well.
So one last question. I want this, just if people aren't already interested in this topic and concerned about whether it's themselves or loved ones, hopefully this drives the point home. We had a sleep workshop in my office last week. Sleep, as you know, probably the most crucial factor in our health. If we're not getting sleep, I don't think anything kills you quicker. Mm-hmm. With that being said, there's a lot of scary statistics when it comes to sleep. You touched on the Alzheimer's facts. Yeah. What are some of the major side effects that people should be aware of if there is sleep apnea happening? What are the negative effects of that?
So brain fog. Brain fog is one of them. Just that daytime fatigue. Yeah. Snoring, frequent waking up during their sleep. It's mostly that fatigue symptom where, one of the questionnaires we ask people is, could you fall asleep while driving a car if you shut your eyes? That sort of thing. So really evaluating if your fatigue is normal or not. That's all I can think about the top of my head.
So, and I guess my question is more specifically in terms of hypertension, in terms of diabetes.
There's so many comorbidities, right? Hypertension, diabetes, all of that is really highly linked to sleep apnea. And so we evaluate that, when the patient comes in, if they have that, that just makes their risk that much higher to having a stroke, having a heart attack. Huge deal. And that's why they've shown that most heart attacks, or a big number, are between 4 and 6 a.m., right? So that's when they are waking up in the morning. Their body has fought all night long, and that's when it kind of gives out when they're up in the morning, right? And daylight savings was another.
That's the number one, right?
Yeah,
number one day, 25%
lose
increase in
an
heart
hour,
attacks.
all of that, right? That's all connected.
Scary things. So if you're sitting at home, you're listening to this, or watching the video, make sure you reach out to Vivos. If you or a loved one is suffering with any kind of sleep apnea, don't let that continue, because the side effects are extremely negative. I want to thank Dr. Lindsay for joining me here today. And if you guys have questions, by all means, comment below. Find her on the website or give them a call. And I hope you guys enjoyed watching this. Thank you for joining me.
Thank you.
All right, guys. Thanks for watching.